about. Chiropractic is all about the central nervous system. No matter what, people think we just crack bones, make noise, but that's not it. What we're worried about is the central nervous system. And at the third week of life, and this will be very brief, I won't get too scientific here, but the neural tube, which arises to form the brain and spinal cord, and the tissues later on will go around to form the actual vertebrae. Okay? Now the central nervous system is what all organs and systems develop from. You know, we have the brain, spinal cord, and everything's going out to everything. Every organ function, every muscle, everything is under the direct influence or control of the central nervous system, either directly by nerves or indirectly through what we call chemical messengers or hormones. Going back into talking about birth trauma, you know, a baby's head is actually used to thin the cervix and dilate the cervix. So the head of the child is actually hitting up against the cervix to actually dilate. So imagine you banging your head up against a wall for 4 weeks. How would that, you know, that wouldn't be very good. So there would be issues and trauma there. Also, from my standpoint, I'd want to find out, you know, how did the delivery go? You know, was there, you know, the average force applied to a child's neck during delivery is 70 pounds of pressure to deliver that child. You know, also, are there any mechanical devices used? There would be other things I'd be concerned about. And then we go on to look at you know, other things that can happen with children. You know, as a child learns to crawl, sit up, you know, falls back, hitting their head on the floor or wall, or, you know, kids are learning to walk, slips, trips, falls, all that thing. And then later on, we talk about playground accidents, issues, sports, and then, you know, siblings. I got beat up by my older brother. I say all the time to my nephews, you know, so they can make them feel bad. But, you know, all those issues. And what does that matter? What does that mean? It just seems like, well, that's just a normal part of life. Well, what we're worried about is what the cause of that is. So when there's trauma to the spine, that is going back and putting pressure on the nerves and disrupting communication. So the way the body works, we have the brain, spinal cord, and all the nerves coming out. And when we put that pressure on those nerves, now things can't function properly. Well, what's that matter? So what happens is, and we'll go kind of that second point there, really what we're looking at is we have 2 systems within the central nervous system. Okay? One we call the sympathetic, which is the fight or flight. So if there's an emergency right now, we're all wanting to get, we'd all knock over Jim just to get to the exit right there, okay? That's what we call our fight or flight system. All right, so when we have these issues, and from a chiropractic standpoint, we would look to evaluate more of the upper part of the neck where the spinal cord is coming in. When there's pressure on that, and now someone's more stuck in that what we call sympathetic system, or that fight or flight system, we're going to see a child who's going to be more aggravated or stressed out more. They're not able to relax, able to focus, and be attentive to what's going on. Because what's happening is we're blocking what the other system is, that parasympathetic system, or the resting system. We want, you know, that's what helps us to calm down or settle down after there has been some aggravation or something that's got us excited. And so the systems aren't able to work. And, you know, a lot of times when we talk about ADD, ADHD, there's a lot of children who can't focus. They can't, they don't have the attention span to focus on what's going on. Well, from our standpoint, and, you know, I'm looking at this from purely a chiropractic standpoint, what is causing that irritation? What's causing that child to be more aggravated? And then, you know, a lot of times people, you know, one of the big things here, like, well, show us the research. Where's the research? Well, you know, in the United States, of all the chiropractic schools, if you combine all the researchers that we have, one drug company would easily double or triple what we have. And there's more than one drug company out there by all means. So we are our own independent part of the healthcare system. Unfortunately, we don't have huge research to show how chiropractic can help. But what we do have are what we call case studies, where it's the patient's response to chiropractic. And these are chiropractors who are out in the field who have seen how patients have responded. And so they write up a research article on it. Or maybe they have more than one patient. They have a group of patients and how their response is. And so, you know, kind of looking at some of the, you know, some of the research that's out there. We have, you know, improvement in signs and symptoms of ADHD and functional outcomes in 4 children receiving torque release chiropractic, that's a technique, it's a technique that I love. I'm probably the only one in East Central Illinois who even knows what it is, and hold a higher status within the technique because of additional training that I've done. So I absolutely love that technique and understand completely that it's about helping to get individuals to relax more, to shut off that system that keeps us aggravated and agitated and helps us to relax more. Then there's another case study of a 15-year-old, you know, with migraine headaches and behavioral and learning difficulties, and how chiropractic is helping. You know, the top one was just done actually this month, and then the other one was done just at the end of last year, so it's more current case studies that we have. And then another thing, Dr. Robinson, out of his office, he got the permission for the parents to put these in. We got some patient testimonies. That's another thing. We have, you know, kids that have chronic ear infection, you know, this child, chronic ear infection and behavioral issues. And, you know, I thought this was amazing because, and what they wrote up as their testimony is that it's very apparent to his parents and teachers that when it's time for the kid to get his adjustment, and when he is, after he gets his adjustment, he's able to sit still and his attention span is much better. So I think it's always great. It's one thing when you're a parent, you know your children, but I think it's amazing that the teacher is coming up and saying, is it time for him to go see the chiropractor, because she can see the behavioral changes in the child because it's been a while since he's been in to be seen. That, you know, pregnant women who are taking Tylenol, you know, for headaches and back pain, research has shown that those children actually now have a higher risk of having ADHD, ADD. So, you know, what are pregnant women going to do now to help get out of pain when they, for years, have taken Tylenol thinking that was a safe thing to take? Well, you know, this is where we want to go back to working to help get people out of, you know, not only back pain but the headaches, and, you know, chiropractic addresses the structural imbalances that lead to those issues. And so definitely some important things there, because, you know, now who knows what research is going to show us in even 5 more years of what we thought was safe to take in this. And then, you know, I thought maybe women appreciate this. And research has shown that pregnant women under chiropractic care cuts delivery time down by 32%. So, I mean, I'm not a woman, but I'm sure most women would appreciate that. So, I know that I kind of went through that pretty quickly, but it's an opportunity to help to understand that what I do isn't just about popping a bone. You know, there's a whole nervous system that we're trying to take care of and get functioning properly. And every time I talk to someone about their kids getting checked, they look at me like they have no clue that it's something that they've never heard. But we have to make sure the kids are starting off right life. And, you know, it's hard for me to stand up here because that was a great documentary about, you know, their life was altered, things were different, but they made the best of it. You know, just as you have. I mean, they've made the best of it. So it's not, I'm not going to stand up here and say, oh, we're going to change everybody and make them normal, as that one person said. But, you know, we're looking at, you know, ADHD, where, you know, it's hard for the kids to focus, and then that puts a lot of strain and pressure on the parents, and, you know, there's a lot that's affected. Why not, let's find a good way to help to make that child's life a lot better. And I don't know, you know, how much medication a lot of these kids are on. I mean, some of them are taking, you know, 3 to 4 different medications, and to me, that's just mind-blowing. Why don't we work to do things naturally and get children better? So, if there's anyone that you could think of that you would, you know, by doing this, that you're like, all right, well, maybe my grandson or my son, just let me know. We will do a first exam and visit for free. I mean, we go out to the public. We want people to understand the awesomeness of the human body and working to get things back where they need to be naturally.